Dr. Claire's here today to help us break the taboo of the menopause. She's also here to absolutely take the fear factor out of it. As she said, that she's here to actually take the blood, sweat and tears and turn it into love, life and compassion. And I can't, for one, wait to get started on this because Dr. Claire's kindly categorised it into 3 sections she's going to be talking about today. 1, the physical side of the symptoms of menopause. 2, the psychological side. And 3, let's talk about that word that we're all scared of talking about and name it, sex. So without further ado, I'm going to hand over now to Dr. Claire. Thank you very much.
So the menopause actually means end of monthly periods. So for many women, if you're having regular periods and then your periods stop, we say you've been through the menopause when you've had 12 months of no periods. So you wouldn't have known that that last bleed was your last bleed, and it's not obviously till you look back. But in a way, although that's a medical definition, it's a little bit arbitrary in terms of symptoms, because we know that symptoms can start way before your periods stop and continue way after that time.
And that's called perimenopause.
Yeah, so the perimenopause is really the start of the menopause transition, where the hormone estrogen that our ovaries make, hormone levels start to go a bit haywire, and that's when you can start to experience some symptoms. So that can be in your early 40s, typically early to mid 40s, and then go on way beyond till your periods stop.
Okay, so obviously you've done a really great job of categorising the symptoms, you know, the numbers that we all say are over 40 into 3 categories, psychological, physical and sex. Do you want to talk about those 3 categories?
Yeah, should we start with physical?
Why not?
Yeah, so
well, they're the easiest ones to actually, people know it's happening, don't they? So
exactly. So 8 out of 10 women will experience hot sweats and flushes during the day or during the night or both. So how grim.
Yeah, I'm one of those. I'll call it out now.
Yes. So as well as hot flushes and night sweats, people can experience all sorts of other physical symptoms. Some are well known, some are not. So of the well-known ones, so everybody talks about weight gain. I mean, how frustrating. So often people will redistribute fat from their thighs to around the middle, so you get that awful middle-age spread. There are bladder symptoms. Your bladder can become a little bit more weak and a little bit more leaky as you go through.
We'll be talking about that in another series of incontinence. Yeah.
Absolutely, yeah. Changes in skin sensation, and so people will describe really vividly sort of a feeling of electric shock, like pain, or a feeling of creepy crawlies under the skin. There's a symptom that's not widely known about called burning mouth syndrome as well, that obviously people can experience. So aches and pains are really common, and you find that lots of symptoms have a knock-on effect on other symptoms. So we've talked about weight gain, we've talked about aches and pains, that stops people exercising, and so weight gain can become more of an issue.
Okay, and again, when we talk about debilitating, some of these factors, you know, you might think, well, how can itchy skin be debilitating? But actually, if you're having that sensation and it's there all the time, you know, I think it all depends what we class as debilitating. But if you were to experience that, it's not funny, is it? I mean, I've talked to a couple of people with it. It's continually with them at times, and it's just one of those factors that can't go away. It's like having an itch you can't scratch, isn't it, really? And no, so how, and with those physical symptoms, what are you finding are the worst of those physical symptoms, and what can you actually advise women to and those transitioning to do about some of them?
Yeah, so it's interesting, isn't it? Because what's really severe to one may not be an issue to another. So aches and pains really slow people down and really affect people's moods, as I said before, because of the knock-on effect on other activities. So it's difficult to say that one thing is worse than the others, but certainly hot flushes and night sweats, I think something that is creeping up on you all the time, making you feel anxious about it, interfering with your ability to work, interfering with your ability to sleep. So yes, hot sweats, but really it's what the most important symptom is to you and how it's affecting your life.
Absolutely, and we have to recognise this isn't just a old age or people thinking, you know, it was aches and pains that got me. I'm a fit runner and I love my life and I love the gym and everything else, and I'm very aware of my body. And there's pains in my shoulder were just incredible, and obviously straight away you go to the physio. It was quite clear to me it wasn't muscular, and it was just so bad, and ended up having MRI scans and everything else. But actually, had I known it was perimenopause, I would have treated it differently. I mean, I looked to my nutrition and to my supplements to help me, and you know, my nutrition, my diet was absolutely shot. So I think we all need to recognise that there isn't a one-stop to sorting out the menopause, is it? You've got to embrace it and look to whether you need any medical treatments, but also the lifestyle you lead has got to change as well to accommodate, hasn't it? But
yeah, I completely agree. This, as I've just said, it is really not one size fits all, wouldn't you? Yeah.
And my menopause centre did a great report, didn't they? That actually highlighted that the better prepared anyone entering menopause is, the better prepared and educated they are on the symptoms of menopause, the better the experience they can go through it with. And that's very similar to, like, you know, as a marathon runner, you wouldn't run a marathon in a pair of slippers. You prepare yourself, you get the right kit, you get the right training, you get the right food inside, you get the right sleep patterns. You know, you just don't get up and run a marathon. So why would we actually allow women to enter the biggest marathon of their lives so woefully unprepared at the moment? So psychologically and physical and sex, it's a huge, big part of, you take those three things out of our lives and actually you're not left with much, are you? It impacts on every part of relationships, to work performance, to actual genuine confidence in yourself, isn't it? So talking about the confidence inside, do you want to talk about the actual psychological symptoms here now?
Yes, because I think they have a massive impact. And what I see as a doctor is often people don't recognise them as a symptom of the menopause transition. So people in the start of the transition, partway through, will often say they can just feel anxiety creeping up on them, that they've never been anxious in their whole life, and suddenly worrying about the small things, sweating the details where they never would before. Symptoms like, you know, it's not uncommon for people to say they don't want to drive on the motorway anymore.
Well, I can recognise that because Sam, my co-founder, she's an executive at Innocent, global travelling all the time, and she got to the stage where she didn't, you know, she used to go global every week, a different country. You'd phone her up and go on, tell me, am I in the right timeline or whatever. But she got to the stage where she absolutely had a panic attack. She didn't want to pack up and she didn't want to go. It was like, how on earth is this woman who spent 30 years doing this suddenly, you know, incapable of doing it? And it is that anxious, just, as she said, it just suddenly came over me. It started to build, and then all of a sudden it became a huge part of my life, and you've got to address it, and it's frightening, isn't it?
Oh, absolutely. And you know, it doesn't matter what you're doing in your job, in your life, if that fear factor starts to hit you, then it stops people doing things, and then their confidence is impacted, their self-esteem. People start thinking about giving up jobs. I mean, how fundamental is that?
So obviously you're seeing a lot more women than I know women, and you know, is anxiety, is confidence, social anxiety, is it a big player in the field of them coming to you with the symptoms, and how do you notice it, and what can you do for it?
Yeah, so I would say it's a massive issue, and it's the thing that a lot of women find so upsetting. And I hear stories of women just saying they feel like they've lost themselves, they've lost their mojo. And so how that plays out is people saying that they're suddenly really anxious to take on tasks at work, they're not taking tasks on, they're not volunteering themselves for presentations. We know that up to a quarter of women in a recent survey are thinking of even leaving their job, and 5% of women have left or changed their jobs, and I hear that frequently in the clinic.
Which is really frightening as well, because at the end of the day, we're good at blaming other things than recognising it's our bodies and our menopause that's causing this. So we can blame the work culture, we can blame the job, we can blame, you know, everything else around it, or look to it as an excuse, when actually we need more women to recognise that, you know, they may be perimenopausal or menopausal, it's not their fault they're feeling like this, and we can get them back to feeling more like their old selves. Because, you know, right now, as we've said in the invisibility report, most women can only name between 3 and 5 symptoms. We've highlighted that there's, you know, 48 there. So if you don't know what you're looking for, you know, you're finding women are exiting, and I don't want for newspapers and that to pick up there's more to do in the workplace. There is more to do in the workplace to support it, but there's a lot more to do to recognise we're in it in the first place, isn't there? So, and why it's happening. And let's not make it fearful for anyone listening. These are things that can be worked on and can be supported, and you can be the best version of yourself, and you can perform. It affects your performance, but only whilst you're not looking after it and acknowledging the symptoms and finding solutions for yourself, isn't there? So how can we absolutely, I mean, it's not just in the workplace, is it? You've actually highlighted before about, you know, at home as well. How are women who are working at home or in the house right now feeling as well on this?
Oh no, absolutely. You know what it's like. You're trying to juggle. So juggling children, rugby kits, animals, jobs. And it's feeling like you're starting to drop balls. That's what people say. And then that just feeds the anxiety. And, you know, when you add on to that cognitive symptoms like poor memory, not being able to find the right words, there are estrogen receptors in so many parts of your brain that when you start feeling that your function is then impaired as well, then that just feeds the anxiety, the low self-esteem, confidence, the low mood that so many women are experiencing.
I mean, you mentioned the rugby kits and the kits and everything else, but actually we forget as well, for those women who are hitting perimenopause or menopause at the same time as possibly they've got teenagers in the house with their own hormones. I mean, we think menopause is bad, but add that into the fuel, into the atmosphere of teenage hormones as well. I mean, it's not a thankful place to be, is it?
It's really not funny. As one with 3 teenagers at home, I can attest to that.
Well, again, and back to the brain fog, we used to laugh at, you know, my mum's generation, she'd just make a laugh, oh, I've gone upstairs and looked for my glasses and they're on my head or whatever. And we used to laugh at that, but actually now we are living longer. Now that we actually are into the workplace and we're doing full-time jobs as well, many of us on top of this, actually that brain fog is affecting, you can be in a presentation and all of a sudden you can't remember what you're talking about. You don't even know why you're in the room. That becomes, I mean, the Duchess of Wessex talked about it this week, about her brain fog. I think, you know, we have to acknowledge that we can do things to actually build the confidence back in our brain and not have as many hits of brain fog moments as possible or weaken them. But it's something that we have to address. And, you know, once upon a time it was funny. Now I don't want, you know, to be laughed at. I want to be supported on this. And, you know, oh, I don't want my kids going, oh, God, Mum's having a funny moment. I want them to say, actually, let's sort this out. So, no, so what else on the psychological symptoms are you finding is a debilitating one or one that's frightening women at the moment?
Yeah, so the worry about, just going back to what you just said, the worry about have I got dementia?
Right.
You know, dementia is so in the forefront of so many minds that when you do start forgetting words and your memory's dropping, people really worrying that they've got early onset dementia. And sometimes all you have to do is reassure people and you can sort of see this relief flood across people's faces.
Well, where do you see fatigue then? Does fatigue fit into psychological or physical?
No.
Again, that overwhelming fatigue is another one that takes you by surprise.
I know, and it's so life-limiting, isn't it? If you find that you just have to give in to it. So it really falls across all categories. So it's part of psychological in that if you're suffering from low mood, low motivation, fatigue is really part of that spectrum of symptoms. And then, of course, going back to physical symptoms, the fatigue can add into there as well, particularly if you're finding that you can't move as much as you used to. So another really common symptom is low mood and depression, and that's showing itself by people just saying they're just spontaneously sobbing, bursting into tears, crying at the smallest things, crying at Strictly or Bake Off or whatever.
And I can remember having a meltdown with my kids over that brought me strawberry yoghurt and I didn't want strawberry yoghurt. And even though that was the only one in the shop, it was all of a sudden, you know, this biggest thing since sliced bread. And, you know, my kids actually, apart from the emotion and finding that I was forever being tearful, was like, Mum's gone batshit crazy. That's what they felt. And it is, you know, I can remember saying to my kids, you know, they came back for a weekend and I was so looking forward to it. But in that emotional side, as someone who's going through the perimenopause, no matter how much you tell yourself, it's an important weekend, you want to enjoy it, there's almost like this gremlin inside you that's making you do things that you know are going to irritate you. You're angry, you're short-tempered, you're tearful. And my kids turned around and said, Mum, I think it's time we went this weekend. You know, you're not feeling your best. And I went, well, that's all very well for you. You can leave me, but I can't leave myself. And I think that's how many women feel, that something comes over them and it's not really them, but they don't know how to control it. And that's why GenM does what it does. We want women to be able to control their menopause before it takes control of you, because it can be quite frightening when it does, can't it?
Yeah, no, I'd absolutely agree. And I think we're completely on the same page, because at my menopause centre, that was the whole premise behind setting out all of that information so women could understand that there is a reason for this. They are not going batshit crazy. No. There is a physical change happening to them to cause it.
And like you say, it's that reassurance. All of a sudden, you've not got dementia, you've not got Alzheimer's, you've not got cancer, you've not got thyroid problems with the fatigue and everything else. You know, the doctor thought I'd got Graves' disease, and straight away you're Googling it. And it's almost, you just, in the end, by the time you've gone to the doctor and you've found everything, you're actually wanting something, you're wanting to, you don't want it, no, it's not that, no, it's not that. Yeah. Actually, when they said perimenopausal, it was such a relief. It really was that, right, I can handle that now. I know what's happening. I'm not a sandwich short of a picnic. Get on with it, Heather. So, no, this is really good. So let's move on to now the really taboo topic within the taboo, and let's talk about sex.
Okay, really super common loss of libido in the menopause. Over 50% of women complain of it in the big surveys that have been conducted. I would say in my clinic it's far more common than that when you actually ask people about it, because it's such a taboo, isn't it? Still, absolutely. People are just not talking about it.
I think there's a taboo on not just the actual ability to actually recognise it, but to absolutely confront yourself and realise that actually I've made all the excuses, but actually I've lost my libido. It's not that I'm too tired, or it's not that this. It's actually I've just gone off sex for a while. You know, just acknowledging it is a relief to some women, because to say it out loud, you've got to come and see you and say, what can I do about it? But too many women, we've heard, are just going silent on this and just living a very lonely existence. And it is impacting on the relationships, isn't it? So why do you think this is, and what is impacting women in menopause with sex? Why is it becoming such a big issue in our lives?
Yeah, so there are lots of different factors that all amalgamate together to have an impact on your libido. So all of those physical symptoms that we've talked about don't exactly make you feel very sexy. If you're having loads of hot flushes, women with low self-esteem who've gained a little bit of weight, there are all the physical factors that can impact. If you're really tired, if you're feeling really low, if you're anxious, that's not going to help. We know that as women gain years, and actually men do as well, I'm not sure if you knew, that desire for sex does naturally dwindle with age as well. So obviously the menopause is a big part of it, but there is the natural aging process as well. And then there can be physical symptoms that are really specific, like vaginal dryness, vaginal soreness, vaginal irritation, that actually mean that sex is either less pleasurable or even painful. And it's so sad that people don't come forward with these symptoms, because particularly the vaginal symptoms are quite easy to treat.
Well, we're going to talk about that in another series as well, on the actual taboo of sex and what we can do with it, because it has, you know, sex is something that should be pleasurable and you know, and enjoyable, but actually it's impossible for some of the women out there, isn't it? And to be in a relationship and have that understanding by the other person of how to support it, but also you have your needs as well. And so it's how, as couples, can we overcome this? And equally, you know, there's the single women out there who need sex as well. So maybe we'll talk about that in another series.
Yeah, I think that's absolutely right. And the saddest thing is when you hear a story, which is not uncommon, like, well, I tried to have sex and it was really uncomfortable, so we haven't for 5 years, for 10 years. And it's just so sad that women aren't coming forward with these symptoms when there's so many positive things you can do to help.
We only have one life as well, don't we? You know, and no matter what, it is a big part of life, that closeness, that intimacy. And it's such a shame that when you're feeling lonely and isolated, we're actually pushing that loneliness and isolation even further away, isn't it? Because one hug, one cuddle, one hug does make such a difference. And, you know, we have to help more women. I mean, it's terrible that, you know, they're allowing themselves, and society's encouraging it, to just keep it quiet, not talk about it, and have it be an elephant in the room when we need to actually go, hang on a minute, I think we can sort this out together. And that's why we need men involved in this conversation, and other partners as well, because you might not want the help, but they can actually encourage you to actually get that help and seek that advice and support that you're looking for. So how many of your clients actually are coming in because they've decided to come in themselves, or how many have actually come to a point where it's been talked about at home and they recognise as a family or as a unit to come in? I mean, is it starting to show now that more families and men are understanding of this issue at the moment of menopause?
Yeah, so I would say that's a minority group, but mostly it's women coming in for themselves.
Right.
But what you hear so much, what I hear a lot of, is women understanding or appreciating the impact that their symptoms are having on the family. So, for example, shouting at children, or, you know, the inner rage that we spoke about earlier, and wanting help to find a better version of themselves.
And I get that they want to be a better version of themselves, but actually isn't it quite sad that we actually start feeling guilty about this as well, and actually blaming ourselves, when actually with that support and keeping it as a family conversation and a work colleagues conversation, we can all be part of this, because, you know, again, it's something that we can't afford to put more. We've had guilt all our lives as working mums, as non-working mums, you know, it's always guilt, guilt, guilt. We've got to stop this and actually go, actually guys, I've supported you through all this time. Mum or wife or partner or work colleague needs me, and I need you to help me here and support it.
Yeah, no, I absolutely agree, because if you worry about symptoms, if you're not understanding what's going on, it just feeds all the anxiety, and there's really good evidence that that then makes symptoms worse.
Yes.
If you worry about hot flushes and you feel that horrible dread as they start to come, actually the hot flush can be more intense.
Right.
Then if you learn the techniques to either breathe through it, or you know that there's more acceptance around you, particularly in the workplace.
And you know, it brings it even more home to me, more and more, why GenM has to help with these brands and these organisations help to normalise that conversation, because, you know, it is the fundamental number one point of where we all need to go on this, because it's not a workplace policy, it's not a gender issue, it's not a gender issue per se, it's not a medical issue per se, it's not a workplace issue, it's a societal, you know, sum of all parts on this, isn't it? There isn't one part of our lives that menopause doesn't affect, and, you know, 51% of the population and a bit more will actually one day go through menopause, whether it be surgical early or natural menopause, because it's not a disease, it's a transition, and I think that's what we've got to embrace and recognise now. So again, when you're bringing these women are coming to you about a topic that they're really feeling uncomfortable about, how do you break the ice with them? How are you getting them to open up and talk about sex? Because I'm sure it's very easy for them to talk about, you know, the hot sweats and everything else. Do you find that it comes in a second appointment, or do you find that once they're in the room, it all comes out and they completely become honest on the whole impact that menopause is having on them?
Yeah, that's a really good question. So I always ask about it.
Yeah.
But often, I think increasingly it is being volunteered. It may not be the first thing that people ask about. But I think the great thing about increasing awareness is people are starting to volunteer those, what could be perceived as slightly more embarrassing symptoms. But, you know, we have lovely long appointments, and I think that makes a big difference. So if you give somebody the space to talk, often a lot will come out, and people will sometimes say, oh, I didn't think I would talk about that, but just having that space and somebody to listen to you can help.
And someone who can't afford a private clinic, what advice do you give them for going to their doctors and actually having that first conversation with their NHS doctor who they might not even have met before? How would you get them to prepare for this conversation? Because you get one chance at really coming out with it, don't you?
Yeah, so I would say preparation is really important. So do your homework, you know, have a look at our website. There are lots of other websites out there as well.
Well, there's the GenM website.
There's a GenM website.
www.gen-m.com.
Have a look and have a Google around and see if you can gain any understanding of your symptoms and the options that you might be interested in talking about with your GP. Yeah. I would say ask the receptionist which GP they would go and see, or nurse practitioner it may be, with hormone issues, or to talk about the menopause, because often the receptionist will have a really good idea.
That's a really
and
good point,
direct you.
and a nice piece of advice there for, because it is, you know, in this world of more phone calls than physical appointments at the doctors, you know, it is something, as women do, we put ourselves last in this, and actually it's something you can put off, can't you? And would you advise, if they can get a physical appointment, to get a physical appointment as well?
I think it depends on what you really want.
Right.
So I can only speak for my own GP practice. being a GP myself as well, that most practices are starting with phone conversations and turning into face-to-face. Increasingly, practices are offering face-to-face appointments also.
But I'm guessing if they're better prepared, it can come across on a video or a phone call much better anyway, can't you? And then you can assess whether you need to see them or you can actually have a better understanding.
Absolutely.
Right?
And I think acknowledging that you might need a little bit more time than a 10-minute appointment can be helpful. So you could ask for a double appointment, or when you have your initial appointment, you could always ask for another appointment to continue the conversation.
Obviously, we're in unprecedented times at the moment. COVID's come into our lives, which we never actually, anticipated or ever expected. And many people are coming with long COVID symptoms now. And when you read the long COVID symptoms, actually, there's many of them there that are very similar to menopause. So how can we encourage women not just to assume they possibly have long COVID, but actually think about possibly they may be perimenopausal or menopausal and seek the right advice and solutions to those symptoms?
Yeah, that's a great question for current times. So I would say have a look at all of the symptoms that we've been mentioning of the menopause transition. Have a look at our website, have a look at your website. Consider completing our menopause questionnaire, which will actually lead you through all of the symptoms of the menopause, and you'll get your own personalised outcome. That could be helpful.
Perfect. Well, brilliant. Well, this session was all about to take the fear and the blood, sweat and tears away from menopause, and I really do believe that right now we've absolutely been able to nail it on driving the love, life and compassion instead, because we have to talk more positively about menopause. So actually, as someone who really does know everything about, or as much as we all know about menopause right now, what would be your top tips to really get that love, life and compassion back into your life through the menopause?
Yeah, I think the first thing has to be, don't you agree, reading about it, as we've talked about. Preparation is key, because that will change your course. It could change how bad your symptoms are. And then have a look at all the different options for helping. So menopause management really isn't one size fits all. And whether it's lifestyle choices, whether it's exercising more, addressing your diet, as you spoke about earlier, Heather, there's medication that can be helpful to some women. There's alternative therapies, which will be helpful to others. And then don't rule out HRT. HRT is obviously not for everybody, and it's your own choice about whether you're going to take it or not. But don't forget, there's hormone replacement therapy, HRT. There are a lot of myths that I think we're going to talk about later surrounding HRT, and people are often frightened or anxious about it. But if you scratch beneath the surface and you look at the evidence for the risks, they're very small. The benefits generally for most women outweigh the risks, and it can be a really effective way of managing your symptoms. So it's having that conversation with your doctor, arming yourself with knowledge and finding the right way through for you.
And I couldn't agree more on that understanding and not fearing HRT, because how many times do we take a Nurofen or an aspirin or whatever and we don't look at the whole pack when you pull out that piece of paper? I mean, you just normally now take the piece of paper out, throw it in the bin, and you don't even look at the effects you can have. So it's actually find what works for you, isn't it? And understand that this is a trial and an error as well, isn't it? That your doctor isn't a magician. They're not going to find straight away the right dosages that might work for you. It's your body, your individual, so you've got to work with this over time and have the patience, haven't you, to really find what you need out there. So, and again, on the nutritional side of things, how big an impact does that have on people's lives, do you think?
Yeah, diet's immensely important, and what you eat can really dictate how you feel. I think where we're at in terms of diet is there isn't one perfect menopause diet, but it's finding what's right for you. It's understanding the changes that your body is going through. Don't forget the long-term risks, health risks that can occur after the menopause, so increased risk of osteoporosis, thinning of the bones, increased risk of heart disease after the menopause. So looking at Mediterranean-style diets, there's good evidence can help prevent heart disease. Looking at have you got enough calcium, vitamin D in your diet can help prevent osteoporosis. Well,
that's any excuse for me to fly out to Mallorca and I'm sorted there. But I want to finish on a positive, and we're determined to finish on a positive with menopause. And actually, what you've been able to highlight now is that ignorance is not bliss. ignorance is not going to do us any good. Actually, don't fear the menopause, accept it's going to happen to you and prepare better for it. So I'd like to thank you very much for today, and I know we're going to do some other conversations with you later on in the future. So thank you very much for now.